So, welcome to today's section. Today, we are going to discuss about the principles of mental health nursing, which is very important in fifth semester. So, as an introduction, I would like to tell principles in psychiatry nursing can be applied to the care of all who show behavior disorders. So, everyone has certain basic needs that must be met no matter what disease he or she is suffering from. So, these principles are general, which are applicable to mentally ill patients as well as physically ill, whereas illness is usually associated with emotional disturbance to some degree. So, being a mental health care nurse, these principles in psychiatry that is general, which can be applied to mentally ill patients as well as the physically ill, where the illness is usually associated with emotional disturbance to some degree. So the first principles of mental health nursing is accepting the patient exactly as he or she is. The first principle is accepting the patient. So acceptance conveys the feelings of being loved and cared, and it provides the patient with an experience which is emotionally neutral, where he finds unlearning of his sick behavior is less threatening before he can relearn the art of living with himself, with others. Okay, so when we accept the patient exactly, so this conveys the feelings of being loved and cared. Okay, so this will reduce the emotional feelings of the patient, and this can he can relearn the art of living with himself, with others. So we have to accept the patient exactly as he or she. So the acceptance, how we can accept the patient. So this can be acceptance can be expressed in following ways. The first one is being non-judgmental and non-punitive. So we should not judge the patient's behavior as right or wrong, good or bad. Okay, patient is not punished for his undesired behavior. Okay, and all direct and indirect methods of punishing must be avoided, like chaining, restraining, put him in a separate room are some of the direct punishment. So, and at the same time, ignoring his presence or withdrawing his importance is a few ways of giving indirect punishment. So we should not give direct or indirect punishment to the patient, and we should not judge the patient's behavior as right or wrong. Okay, so we should not punish the patient. So that comes under being non-judgmental and non-punitive. By showing these methodologies when we take care of patients, we can, that is a one way of accepting the patient. Okay, next, that is sincerely interested in the patient. So being a mental health nurse, for accepting the patient, we have to be sincerely interested in taking care of the patient. So this can be demonstrated by studying patient's behavior pattern, making the patients aware, using time spent with him on these things he is interested in, being aware of his likes and dislikes, explain when his demands cannot be met, dealing with his comments, complaints, accepting his fears as real to him, and avoiding subject on which he feels sensitive. So this way we can be we can show interest in the patient sincerely, and recognizing and reflecting on feelings which patient may express. So the patient may convey different things, personal matters. Patient may communicate in different way to us. So during this time, the nurse acts as a sounding board for the patient's strong or negative feelings. The nurse develops skill in identifying the feelings actually expressed. For example, we get so when a patient says, I would like to break someone's neck, we understand that he is angry at somebody and he is expressing the anger. So we have to recognize and we have to reflect the feelings the patient may express to us. Okay. Next is talking with a purpose. So when we during our conversation, we must resolve around his needs, wants and interests. Direct approaches like reflection, open-ended question, focusing on a point, presenting reality is more effective when the problems are not obvious. Avoiding evaluative, hostile, probing responses. We have to avoid the hostile feelings. So when you study about interpersonal relationship, maintaining therapeutic communication, we'll be studying how to communicate with the patient. So when we are talking to a patient, there should be a purpose, and we should understand about the needs, wants, and interests of the patient. Next is listening. Listening is an active process. 2 years required for what the patient says verbally, and the third year is required for what the patient is otherwise non-verbally saying. So we have to listen to the verbal and non-verbal communication shown by the patient. Next is permitting the patient to express strongly held feelings. So patient will be having different emotion, different feelings. So strong emotions bottled up are potentially explosive and dangerous. It is better to permit the patient to express his strong feelings without disposal or punishment. We have to talk to the patient. For example, we can ask about the worries of the patient, so that the patient will be expressing. So like that, it will be easy for us to understand the problems faced by the patient. This way it will be easy for a mental health nurse to accept the patient exactly as he or she is. So the first principle is accepting the patient exactly as he or she is. So these are the ways how we can accept the patient: by being non-judgmental and non-punitive, sincerely interested in the patient, recognizing the patient and reflecting on the feelings, talking with a purpose, listening, permitting patient to express strongly held feelings. Hope you have understood. The second principle is use self-understanding as a therapeutic tool. The second principle is use self-understanding as a therapeutic tool. So self-understanding leads to understanding to others. Patient's behaviors can produce lot of anxiety or fear in the nurse, and she ought to understand why she is anxious or frightened. So we can understand ourselves better by exchanging personal experience freely with our colleagues, discussing our personal reactions with an experienced, and participating in group conference regarding our patient care. So we have to understand ourselves to understand others. So we can understand ourselves by communicating with our colleagues, with experienced staff, participating in group conference regarding our patient care. And next is use consistent behavior to increase patient's emotional security. So being mental health nurse, we have to see that we are maintaining a continuity or a good promises. Okay, patient to be consistently and continuously exposed to an atmosphere of quiet acceptance, permissiveness to be limited. Example, with homicidal, suicidal, hyperactive and suspicious patient, we have to be very careful when we are giving the answers. Okay, patient is allowed to feel as he does, but limitations are put on his behavior. Attempt to win patient's liking is most. So when during our care and during our conversation, we have to be very careful. We have to use consistent behavior to increase patient's emotional security, and we have to be very careful the patient who are committed homicidal, suicidal or hyperactive and suspicious patient. And reassurance given to patient in acceptable manner. So we may give some of the assurance. So that must be accepted by the patient. That must be in a minimal level which can be accepted based on the condition and situation of the patient. So reassurance is building the patient's confidence or restoring his confidence. While giving reassurance, we must avoid saying to the patient some of the bad promises or false promises. Next, patient behavior is changed through emotional experience, not by rational thinking. So we need to observe the patient when he or she says or does. Analysis of the observation should be done to draw the motivation or purpose behind this talk or action. So during our care, we will be communicating with the patient. We have to observe, we have to analyze what the patient is telling, what the patient is doing. Something we have to frame, an objective framework will be there. We will be getting from the patient when we talk to the patient or when we see something the patient does. Okay, while working with the patient, learn his basic problems. Guess what he will do? Keep asking yourself what is the goal of the patient and why he behaves like this. So be objective. Objectivity is not coldness, but it is indifference and absence of feeling and ability not to let your own judgment confused. And so that is patient behavior is changed through emotional experience, not by rational thinking. So if we find something the patient is having negative thoughts or negative thinking, negative actions, like for example, we can arrange a role play or social drama. Okay, so through that, with the patient behavior can be changed through emotional experience. So unnecessary increase in patient's anxiety must be avoided. The following approaches may increase the patient anxiety and should be avoided, like showing attention to the patient's deficit, making the patient face repeated failures, placing demands on patient which he cannot meet, direct contradiction on psychotic ideas. So we have to avoid the anxiety in patient. Next is objective observation of the patient to understand his behavior. That is, we have discussed objectively. We have to see the actions and the communication of the patient. It is the ability to evaluate exactly what the patient want to say and not to mix up one's own feelings, opinions, or judgment. Okay, so we should evaluate the patient's condition by seeing his actions, by communicating with the patient. And next is maintaining interpersonal relationship. This focus the personal emotional need of the patients and not on the patient needs. So it is therapeutically oriented and planned. It is always based on patient's needs. Nurse differentiate between patient's demands and actual needs. It is for purpose on bringing adaptiveness, integration, and maturity in relationship. That is, we have to maintain the nurse-patient relationship with all the patients who come across, and avoid physical and verbal force as much as possible, especially the patients who are suffering from mental condition. So any kind of force results in psychological trauma in patients. So restraining the violent patient is for example physical restraint. If all needs to be used, the following points should be kept in mind. That is, carry out the procedure quickly, firmly, and effectively. Do not show anger while tying. Tell him the reason until he will be allowed to mix with others when he get the control of him. So attend his needs as usual. Never show him that he is being punished. And after he becomes controlled, never remind him again about the incident. So when we use some physical restraints, we have to be very careful. That is, maximum we have to avoid physical and verbal force as much as possible when taking care of psychiatric patients. And next is nursing care is centered on the patient as a person and not on the control of symptoms. Okay, so detailed analysis and study of the symptom is necessary to reveal their meaning and their significance to the patient. So two patients showing the same symptoms may be expressing two different needs. Okay, so even though we know the theoretical aspects of the condition, when doing the nursing care, the care is centered on the patient as a person. Okay, not on the control of symptoms. So each person is unique. So everyone will be showing different signs and symptoms, and everyone will be having different needs and wants. So explanation of the procedure and other routines are given according to the patient's level of understanding. So in all nursing care, not only in psychiatry, wherever we care the patients, explanation of the procedure and other routines are given according to the patient's level of understanding. The extent of the explanation given to the patient depend on his attention span, level of anxiety, and level of ability. So it should never be withheld. Every patient has the right to know what is being done and why it is being done on him. Okay, even though if the patient is having any other issues based on the mental health, like we should know the legal issues also in psychiatric patients, but according to the patient right, he is having the right to know what is being done and why it is being done on him. So we have to explain the procedure based on the level of understanding of each patient. Hope you have understood. And the last principle is many procedures are modified, but basic principles remain unaltered. We have to follow the basic ethics in nursing. In psychiatry, many procedures may be modified, but the underlying nursing principles remain the same. Okay, hope you have understood. So these are the principles. This is an important topic in psychiatric nursing. So hope you have understood. Thank you.